seems to be a disagreement between Pfizer and the U.S. government on the need for booster shots. Do you anticipate getting any clarity on that in this afternoon's meeting? And can you just give us a sense of what is at the crux of that disagreement?
Well, first, this meeting is a meeting that HHS is overseeing, and certainly I would refer you to them for a specific readout of the meeting. But I would say that we don't see it as a disagreement per se, but we provide public health information and make determinations based on a large swath of data, and that relates to booster shots as well. And some of that information that the FDA and the CDC look at, and this was in their statement last week, does include some private sector data, and that can be part of how they assess what recommendations will be, but it's a much broader swath of information and data than that. Now, data we continue to analyze. Science evolves, and we have long said that we will reserve optionality, including how we're purchasing doses of vaccines to ensure we have maximum optionality for the American public. But any assessment would be made by the CDC and the FDA, and we made clear last week that wasn't a recommendation being made at this time. I'd also point to something that Dr. Fauci said yesterday when he was out there on some of your networks, when he conveyed that there could be assessments made about certain swaths of the population as well. It may not be all or nothing, but that's something that our scientists will continue to assess, and if they make a conclusion that booster shots are recommended, they will provide that information publicly, and it will be based on a large range of data and information. Go ahead, Karen.
Thanks, Jen. I just want to point out that HHS is not commenting on that meeting that's taking place today with Pfizer. There's nothing else you can share ahead of that of how seriously the administration is considering the possibility of booster shots?
Well, not to minimize a meeting, but I would say that we regularly meet with and engage with our health and medical experts regularly work and meet with companies to understand the latest data, and that would certainly be a part of an assessment of recommendations moving forward. The point I was making in response to Jeff's question was that it's not based on solely the information or data from one company, which hasn't been concluded or hasn't been fully published publicly either. But our health and medical experts will look at the data around the vaccine holistically. We'll use any further data as a consideration moving forward. But I wouldn't see this meeting today. I'm not surprised that there's not a big readout from HHS.
You mentioned other companies. Has the administration heard from any of the other vaccine producers about the possibility of a booster shot and what they're pushing for?
Again, I would leave that to any company to provide any information publicly about what they're assessing. We are in touch with leaders of these companies regularly. We do look at our own data. We welcome their data as a part of that assessment, but the CDC and the FDA will make a recommendation based on their own assessment.
If there is a third shot recommended, would the government cover the cost of that shot as well, and what considerations would have to take place to get funding for that?
Well, we have in our contingency planning, led by Jeff Zients and the COVID team, I think we've indicated from here that we have purchased the number of doses we have and indicated we want to increase manufacturing in these facilities around the country because we want to have maximum optionality, including depending on what is most effective with children under the age of 12, including if there is a booster shot needed. So that is certainly has long been in our planning, even in advance of knowing whether that will be a recommendation made by our health experts. Go ahead.
Thanks, Jen.